I'm Mrs. Robertson, and I work at the Reese campus with the skills department, and we're going to do an open wound dressing change. We do have the other one, the first wound care done, so this will be the one on an open wound. What you'll do, you'll first go and check your chart and read the orders to make sure that you're going to do the right dressing and what the doctor had ordered. After you check your chart, you need to know something about the patient, the location of the wound, the type wound, and of course the dressing changes to be done. You also need to know something about your patient. You may even look at the allergies on the chart when you're viewing that chart. I like to go ahead and look at the nurse's notes to kind of see what the previous wound care, what the wound looked like, so I can compare the wound care that I'm doing today to what the nurse charted. Once you've done that, then you're ready to go. You can go ahead and wash your hands, and you need to gather your supplies. And the supplies for that would be just your 4x4s and whatever the doctor ordered, you would need to gather those supplies. You go ahead, you walk in the room, greet the patient if you've knocked on the door. Once you've greeted the patient, you need to identify yourself, you need to wash your hands. After you wash your hands, you need to come over and go ahead and check the armband to make sure if they're allergic to anything that you may be applying to the wound, like tape or betadine, but you need to check the allergies on the patient. Now you need to explain to the patient what you're going to do. Make sure on the pain level of the patient, you need to rate that pain in case you need to pre-medicate before the wound care. If you do need to pre-medicate, you can leave your things, they're still sealed, and you can go ahead and go pre-medicate the patient. If the patient's not in pain, then you need to get everything where you can get to the patient easily in the wound, depending on where the wound's at. I don't need to drop the side rail because I'm doing an abdominal wound. So I just need to raise the bed up to my working level. I also have a trash bag or trash can here with a biohazard bag in it because this is an open wound. So this is comfortable to me for my level. What I'm going to do is tell the patient I'm going to move the covers back. Try not to expose the patient any more than you have to. Also make sure the room you have privacy. You may have to have guests leave and make sure the door's shut. Because in this situation, you're going to have an abdominal wound. So we'll go ahead. We're going to take the gown and we're going to pull it up, tuck it so it doesn't fall back on the wound. Once we've done that, now we're going to wash our hands. And we're going to put on some wall gloves because we're going to remove the dressing, the old dressing. So once we get the wall gloves on, we will go ahead and remove it. I'll remove it where it's not turning it towards the patient, but away from the patient. Sometimes if it's real bloody or it's got an odor, it would be better not to turn it towards the patient. We're going to go ahead and hold the wound bed down or the tissue around the wound bed so when you untape it, so that it's not pulling on the wound itself. Once you get it, you go ahead and you look at the dressing because you want to be able to document how much is on the wound or how much is on the dressing. You want to document the amount, the color, and if there's an odor. So once you get that, you can take it into this hand. You're going to take it, pull it over, wrap it up, and then you can put it in this hand. Go underneath the glove, and you've sealed it. And you can drop it in your biohazard. Now you can actually look at the wound itself. When you're looking at the wound, you want to look for the tissue inside the wound bed. You also want to look around the wound bed that's outside of the wound to see if it's red or swollen or break down around it. What I do when I look in the wound bed, I want to look for dark tissue, which is necrotic tissue or eschar. I want to look for yellow tissue, which is slough. And then I want to see how much granulated tissue there is. It's the red beefy tissue is the granulated. That's healthy tissue. After you've assessed the wound, then you're going to wash your hands and we're going to go ahead and open up your supplies. I open up the supplies that I'm going to use as close as I'm using them. So I'll put my 4x4s first and you're going to open it away from me. So you will open like that. Here's my ABD. We're going to open within your 1-inch border, and then you're just going to leave it in the package. You can get it open. Okay. Now, we're going to open the sterile kit, not the sterile kit, I'm sorry, but the culture for your sterile culture that you're going to obtain. And we're going to leave it here, along with everything else. Okay, now I'm going to loosen the saline and then I'm going to go ahead and glove, because we have to clean the wound bed first before we take a culture. So I'm going to wash my hands, and we will go ahead and put the gloves on. And these are sterile gloves, because you're going to have to clean the wound bed first. So what I'm going to do, I'm just going to put the first glove on so I can go ahead and get my saline. Once you get your glove on, the one glove, we're going to go ahead, and when you've got your supplies, you collected your supplies at the beginning, you should have dated or made sure if this was open, it was not new, that it was within 24 to 48 hours, or the hospital policy, and you can use it then. We're going to go ahead and loosen the lid. We're going to come around this way. I'm going to go ahead, so I don't want to wet both two of my 4x4s. So I'm going to lay two 4x4s on the inside. You may have to fold them because this is a little thing. Lay them right there on your ABD, because you'll use those with your ABD. Okay, so I'm going to take the rest, and I'm going to go ahead and lip it. Make sure you get the lipped. Now I'm going to take it and I'm going to pour, and make sure that it's, I'm going to lip it again because I didn't have that seal all the way, the label, to the palm of my hand. So we want to make sure it's in the palm of the hand facing. Now I'm going to pour it over my 4x4s. I'm going to go this way from at least covering my field. You don't want to cross over your field. Okay. Now I'm going to come that way. I'll go ahead and put the lid on so it doesn't spill. And I'm going to go ahead and put my other glove on so I can clean the wound, because it's going to have to be, I'm going to have to get into my 4x4s. And I'm going to get a new glove because this one's tore. So we'll go re-glove, and it's okay if you need to re-glove. Sometimes the glove is always, if it tears, to re-glove. Okay, so now we will be ready to go ahead and get into the sterile supplies. On a wet to dry, you don't want it, they're real wet, so you have to rinse them out. I'm going to go ahead and situate and kind of take them apart and make them a little fluffy, because once you get into the wound bed, it's going to be hard then, because you're going to have one hand you're cleaning the wound bed with. So I'm going to go ahead and kind of prepare the wet dressing so that I will be able to get to them easier when it comes time to place them. And then the rest I will use to clean. Make sure they stay in the kit. Kind of fluff them out. Okay, so those will be the ones, I will place those in the wound bed. Now I'm ready to clean the wound. Okay, upon cleaning the wound, you're going to go inside the wound and clean from the top to the bottom of the wound bed. And then you can just start. Once you've done that, take the other hand, your non-dominant hand, and get another clean one to clean with. And you said this is where it's the hardest part if you don't go ahead and take them apart. And then you transfer it, you're going to clean from the top to the bottom, okay? So once you clean the wound bed, now you're ready to get your culture little container, and it has the tip in the inside of here. So you don't want to touch, once you've cultured the wound, you want to make sure you do not touch the tip of this like swab against the outside or anything else. So like I said before, what you want to look for is the granulated tissue. So you just open it and you bring out the swab very carefully. And so we're going to look, and all this is granulated. So we're just going to go inside the wound bed and we're going to do a Z-track. And a Z-track is actually the letter Z. You make the letter Z, and you just want to make a Z-track with it. Once you've got that, then you're going to take it and you're going to put it back in here very carefully so you do not touch the outside. Okay, when you get through, then I'm going to lay this, but if you'll remember, do not forget, because I have gloves on and I'm not going to get my pen out of my pocket, but you'll lay it here on your biohazard bag as a reminder, and it's got the date, what kind of wound, the physician's order. It'll ask if it's aerobic, anaerobic, but it wants all this information on it, so be sure and label it. And then you can lay it right here on top of your bag. Now what we're going to do, we're through with that. We've already got everything ready to go. We're going to go ahead, take the sterile gloves off, and we're going to wash our hands. And we're going to go ahead, you can even remove this now if you want to. We're going to go ahead, wash your hands, and reapply sterile gloves for the actual cleaning of the wound again, and then placing of the wet tissue. So we'll go ahead, we're going to put the sterile gloves back on. And just pick up the outer corner of that. We're going to go in here. And we'll put this glove on. Making sure the thumb doesn't want to. Once you get it on, you can straighten them out and make sure they're fit, okay? Okay, so what we'll do, we're going to take this hand, we'll transfer to this hand, and then we're going to clean the wound. We're going to take another, transfer to the hand, clean the wound. Now we're going to go to the side of the wound closest to us. We're going to pick up another one, transfer it, clean the wound. Go to the next one, transfer it, and clean the wound going down. Once we're through with that, now we can place the other 2 or 3 that you have left in the wound bed itself for the wet to dry. So we'll pick this up, we'll transfer it. We're going to put it in here, and then we'll transfer again, and then we'll put it in here. Okay. Now we can take the 2 that's on top of our ABD, and you can go ahead and pick them both up if you want to, because you're going to take the outside that's not up against the patient, and you're going to place, and you've transferred it, okay? Now we have our ABD, which if it gets stuck, you're going to have to hold. You're going to have the blue up, the little blue line, and you can transfer it and you can place it. And now you're ready to tape. Some people have their tape pulled off. I tend to not have my tape pulled off because of long pieces. It tends to get, they tend to get tangled up on me before I can even get it done. So once you get your tape, and make sure you tape a box tape. That's the kind I like to do, especially you have to with this because you have dressing inside that wound bed that you need to maintain in the wound bed. And if you don't, you will tend to, it'll fall out. So I don't tape on a dressing like this, just the 3 pieces. I tape like a window lock. So I'm going to go ahead and tape it. And then we'll be ready to label, put our name on it, the date and the time, because some dressings you change more often than every 24 hours, depending on what the doctor ordered. Also, on the wound culture we did, make sure that you read if it's aerobic or anaerobic, because it will make a difference on which tube you get for the wound culture. So, now you're ready to label. You can put your date, your name, or your initials, the date and the time. You can either put it on a tape, a piece of tape, like cloth tape, and put to the top, or you can label it on there. Once you're through with this, I go ahead, clean my supplies, get them off the table. It kind of leaves this exposed for me, so I will be sure and not forget. I usually go ahead and cover up the patient. And I don't use this glove because you don't know what you're transferring. So I go ahead and take my gloves off. I'm going to wash my hands. And I'm going to go ahead and get the patient now covered up. Once I've done that, I'm going to go ahead and get the patient in a safe position by lowering the bed. If you did lower a side rail, be sure and put the side rails back up. Give the patient the call light, and also ask the patient how their pain level is after you finish the wound care. Once you're through with that, then you've already disposed of everything. Make sure your lid is good and tight on your saline. Now it's time, and we need to label our tube. I'm going to go ahead because I want to make sure just anything I use on a wound, I like to have gloves. So I'm going to go ahead and use, and I'll leave one glove here, but I'm going to use 2 gloves. I'm going to get in my pocket, get my pen, and this is the time I would go ahead and label my tube. Once my tube is labeled with everything on it, be sure and put it in your bag. Close it, and I'm going to leave this glove here so I can transport with that on the outside. One thing you need to do is make sure, again, do a second safety check on your patient. Your patient has his call light, everything in reach, everything's put up. You're ready to transfer. You can go ahead, discard the gloves, wash your hands, everything is in here. I usually would take this, put it on the outside so you can carry this on your label. That way, because you cannot wear gloves outside the patient's room. So this way you can still hold on to your bag and you can transport it either to the nurse's station where it goes for transport, or you can take it to lab. When you do document, when you're through with the patient, you've already done your second check, you can leave. But when you document, be sure and document what you saw on the dressing, the old dressing. Make sure when you document, you put what the wound looked like after you cleaned it. Also, be sure and put in there that you did culture the wound with aerobic, anaerobic culture. Also, you need to document how the patient tolerated, and then document how much tissue you saw that was healthy tissue, like the red tissue, or if there was eschar or slough noted in the tissue bed. When you're through with that, then you can do a second safety check. Make sure, even in your documentation, that you put that a safety check was done and that the patient was safe, with side rails up, brakes on the bed, in low position. Also make sure you put that you maintain sterile technique throughout the procedure. Thank you.